Hello, and thank you very much for joining us on Upfront on JoyNews channel. My name is Winston, and it's always a pleasure to have you join us every Thursday and Wednesday evening. So currently, our COVID-19 cases stands at 5,408. So many of you have become worried, and you've asked that simple question: how come we're told that we'd actually peaked, and yet we're still having an increase, in fact, a rise in the number of cases? In fact, on last week, we're told by the Ghana Health Service that our case count actually peaked on the 25th of April, as you could see. And, the fact that on the 25th of April, we had reached about 280 cases, and you can see that in that graph that the Ghana Health Service shared with us. Yes, that's the graph that the Ghana Health Service shared, this particular graph with us, that indicates that on the 25th of April, the country saw a peak. Then, on Sunday, the president told all of us that, well, the 921 cases that we have is as a result of backlogs from the 26th of April. Just picture this. We're told the backlog is from the 26th of April. But mind you, when the Ghana Health Service came to our homes, if I could put it that way, last week, they told us how they had up-to-date data up until the 3rd of May 2020. So up until the 3rd of May, the Ghana Health Service told us that the samples and the results we were seeing were from the dates that the samples were taking. In effect, on the dates that the sample were taking, what we saw were the number of positive cases from that day. So how come that in one instance we're told that we had peaked, we have data from all these days, and we're told that the very days that we're told we had data from, there were still backlogs? And so that will lead us to our conversation for this evening. We want to understand Ghana's case count, the facts and the myth behind all of it. Our guest this evening is Dr. Ishmael Norman, who is the president for the Institute of Security, Disaster and Emergency Studies, and he's also a public health specialist. And so he would help us understand all the questions you have been asking. But even before we get into all the issues, let me say good evening, Dr. Norman. Thank you very much for joining us.
Good evening, Winston. Glad to be with you.
Great, but before we get into issues concerning our case numbers and all of that, it's important we deal with one other issue, and that issue has to do with the Ghana Tourism Authority. So according to a press release which has been confirmed by them, now drinking bars can open, and you can see that on your screens. The fact that drinking bars can open, food joints can open, people can sit there, eat and drink, but they are to maintain social distancing protocols. What do you make of this, Dr. Norman? Is it a good thing for us?
I am just as surprised about the order as most of your viewers are, and yourself. I think the Ghana Tourism Authority didn't decide to do it by itself. It was government that told it to do it. And so, for the same reasons why the finance minister said that they had to lift the restrictions, the 3-week-old restrictions, because the country couldn't afford it. I think it's the same economic rationale that is informing the decision by the Tourism Authority to ease restrictions at the hotels. I think it's a very bad decision. I have been fortunate enough to have operated a hotel business in this country for at least 15 years. And I think I have the right to speak authoritatively about how people behave in hotels. And if we are worried about the numbers going up, this is one of the most...
Hold on with those thoughts, Dr. Norman. We'll come back to you shortly. We need to go for a short break. When we return from the break, we'll actually get into why you think that is a bad decision, why you think it's a terrible decision, and also share with us your experience in managing the hotels and why you think this wouldn't work. This is Upfront on JoyNews channel. I'm Winston Amma. We'll be right back after the break. All right, so welcome back from that short break, and thank you very much for staying with us. This is UPfront on JoyNews channel with me, Winston Amaso. We have Dr. Ishmael Norman joining us, who is the president of the Institute for Security, Disaster and Emergency Studies, and also a public health specialist. Dr. Norman, you're talking about why you believe that the decision to allow these, drinking spots, food joints and restaurants to have persons sitting there eating and also drinking. Why is that a bad decision, Dr. Norman?
I think we have to go to WHO. WHO has advised all the countries to be very careful in the way people access alcohol, because when people become inebriated, when people drink, they let caution to the wind. And so for me, I wouldn't have advised the president to actually ease restrictions on the hotels. It's the same concern that I've had with the markets, but we know that the market is a very critical place for everybody to eat from. But hotels are not that critical. We have noticed that at least people have been able to sleep under shelter for the past few months that we have gone through this. So it's not one of those industries that have to operate. But I can understand the concern of government. The big hotels are hemorrhaging and operating maybe at 10% capacity. But the average Ghanaian doesn't adhere to instructions so easily. And it is the same reason why someone like Pastor Otabel said the churches should not be eased, that they should continue to be closed. I think it's the same justification that I would say that the hotel should not have been allowed to operate, because we are going to see a real uptick of cases because of reckless behavior of people at hotels. Guests at hotels do not respect hotel workers. Sometimes when I was running my hotel, I dressed like the watchman, and people came in to talk to me as if I was an idiot. So they look at women that work in hotels as some kind of, low class people.
Yes, but Dr. Norman, when you say
easily take instructions from people.
Okay, but Dr. Norman, when you say because of this, where I would see an increase in our numbers, I need to understand why you think that would happen. What is the justification of that statement that you've just made?
Okay. We are looking at people wearing face masks. Well, how are they going to be drinking if they are wearing the face masks? Okay, how are they going to be eating in that space? And they're going to be, yes, they will practice social distancing. But if you sit down to dinner, for example, that will last for maybe an hour. How many people are supposed to be at a given table? And what will be the distance between the people?
Are you saying it's impossible to practice social distancing at dinners and at restaurants? Is that what you're saying?
It's going to be very difficult because it's a very impolite way for people to really socialize. If they're going to socialize, and people will socialize.
Is it possible to practice social distancing at restaurants and during dinner? Is it possible?
It is possible to practice social distance only between related persons. But if you go to a restaurant and you meet somebody that I wonder how it's going to be. We just have to wait and see how the whole thing is going to play out. But it's not a very easy protocol to enforce. And so for me, on a part of caution, I wouldn't have advised the authorities, and I believe this is an order from the presidency to the tourism authority, because they don't act on their own. And so for me, whoever advised the president didn't do a good job.
But to be fair, when the president announced over the weekend the extension of the restrictions, he talked about how churches and all these places remain closed. But the Ghana Tourism Authority also says that they've been directed. If you read their letter, it says, following the president's address to the public on Sunday, 10th May, the Ghana Tourism Authority, under the auspices of Ministry of Tourism, Arts and Culture, issues the following guidance for the hospitality industry. So while the president addressed, he talked about how all these things would remain closed, and when it comes to food, eating joints or restaurants, you could just go and pick your food. But you talked about economic reasons. Are you by this suggesting that we've ignored, the impact that this would have on our health for the benefits that would accrue to us economically?
Most definitely, because what would be the justification for easing restrictions on the hotels? It just, for me, I am just as puzzled by this decision as quite a few of the decisions that this country has taken in regard to the management of the COVID-19 pandemic. I think it's not a very smart way to go about when your cases are going up, and even though we're supposed to think that we have reached the peak.
So you're actually laughing when you say we're to think that we've reached our peak. Why? You doubt the fact that the measures we've put in place are working?
I must say that some of the measures put in place are truly working. The reasons why the case count is going up is because aggressive contact tracing, testing is happening. And the reasons why we are finding new cases is because we are testing more people now. And so now that we are testing more people, we are going to see a real uptake of the cases. Don't forget, it started with 2 people, and now we are 5,400 plus.
Yes.
It's going to just keep going and going for a while before we can see the end of this.
Okay, so I'll get back to our case count and, the facts behind it and all. But let me just wrap up on the, release from the Ghana Tourism Authority. So when it comes to, you've talked a lot about the hotels, you've talked about the restaurants. How about the drinking spots or drinking bars? Because it's one thing that has got many persons excited. They seem to feel that they could at least go and sit down now and have a bottle or so. What do you make of that also? Is that a best of decisions around the times we find ourselves in?
It is not. As in my estimation, it is not. People have basically gone through a long period of being, shelter in place. And yes, they go out, they buy their drinks to go. But when they meet, now they can go and meet in a drinking spot. When people have suffered from cabin fever for a while, shelter in place, and then they have now an opportunity to go and sort of celebrate, even though government will not tell them to go and celebrate. That's basically the hidden message. They will go out, they will get drunk, and they will let caution to the wind, and that is where we're going to see quite a few new cases coming up. I think the whole approach to managing this pandemic hasn't been top-notch. The way we managed the lockdown wasn't particularly good, locking a few portions of the country down. If they had gone wholesale and done everything at once, and at least for the 3 weeks that government was able to sustain this country in a lockdown situation, would have been much, much better. So they are adding a lot more fuel to the fire, and I don't understand why they are doing it, because it's going to cost more to take care of the people that will get sick.
Okay.
It's going to get bad.
We'll get to our approach shortly, but let's look at one thing. So last week when the Ghana Health Service addressed all of us, they told us how we had reached our peak status on the 25th of April. And the graph that I showed earlier indicated that we had about 270, 280 cases when we peaked. Okay. Now, following that, the president, in addressing us, and when we get to the Ghana Health Service decision about, comments about our peaking, they also told us that, the graph that we were seeing were as a result of dates on which the samples were taken. And so the date that a sample is taken and the number of, infections or positive cases is what they reported to us. Now, on Sunday when the president addressed us, he told us that, the 921 cases that we had at the time, or on Friday, was as a result of backlogs from the 26th of April. Now, a bit of a confusion here. So the Ghana Health Service told us they have data of number of positive cases on the 26th of April up to even the 3rd of May. How come that after that we're still being told that the case count we had or the number of positive cases we had on Friday were coming from backlogs dating as far as 26th April? You are the public health person. Maybe you can help us understand this, because there's a bit of confusion here, Dr. Ishmael Norman.
Well, the confusion can only be explained by the people who actually created it. But looking at it from the outside, I think we have to give the president the benefit of the doubt. Everybody in Ghana knows Nana Akufo-Addo is not a medical doctor. He is a consummate lawyer. That's what we know. So the data that he gets are from his science experts. And he keeps mentioning the fact that decisions are based on science. So the scientific team that he's relying on for advice are the ones that we need to interrogate.
Exactly.
Having said that, the correction, the president has the right to be sincere and tell the people that maybe there were some cases that we didn't report. So I think that is a very admirable, honorable thing for the president to do. I will not fault the president on that. My problem is with the Ghana Health Service.
And what is that problem with the Ghana Health Service? What is that problem with the Ghana Health Service?
The problem simply is this. Already there is suspicion and doubt that the figures are being fudged by government. And you know that the president will be speaking very soon after your public, your press conference. It is your duty to have taken all the necessary measures to correlate the figures that are coming from the various testing centers, because it's not that difficult to count. So for me, for them not to have taken the precautions to make sure that there was zero mistake in terms of the count, I think is where we need to interrogate. I think the Ghana Health Service took a very relaxed approach to the whole thing, that probably we are out of the woods. But as they subsequently corrected themselves, we are not out of the woods. I will not blame the president, because he's relying on his experts, and so I will grant him plausible justification for why he did that, and I consider his correction to be a very honorable and virtuous act. I normally don't say these things, but on this one, he's not a doctor. He only acts on the information he's given, hoping that he's got the best brains in the country to advise him. If it didn't pan out that way, we have to then go to the people who are advising the president.
So these same people you're talking about, Dr. Norman, so the experts you're talking about, I mean, are those who actually put out these figures. And they have told us that this was the case. So are you by this suggesting that the Ghana Health Service, in announcing that, made a mistake, or they were economical with the truth, and thus used the president in telling us what the real picture was?
I don't like to characterize it as if they willfully came to deceive us. These guys have been under a lot of stress for a while. I'm not holding brief for them. And I think that there was a little bit of, hooray, we are almost out of the, out of the woods, and things are beginning to mellow. And so they let caution get out of them. I think they could have exercised control their exuberance, thinking that the end was near. The end wasn't near, and it's not going to be near anytime soon. Okay. I don't think we should whip them. I think we should support them in the work that they are doing. I do believe that the plateau hypothesis that they advance, it's not ever going to happen again. They have learned their lesson. I do believe that. I know a few of the people that are involved, and they are very careful people. Unfortunately, maybe out of fatigue, because there is something called first responder fatigue that is actually operating at this moment on some of the frontline workers. So some of them may even suffer post-traumatic stress disorder. So they also need our help, they need our prayers, but they should make sure that they don't make mistakes like this, because it brings into disrepute the government effort to inform the public. In risk communication, the source of the communication is as important as the content of the communication. So if the source, Ghana Health Service, appears to be not telling the truth, they really lose a lot of credibility in the face of the people. Okay. And so next time they dish out another information, another figure, people are going to say, okay, what are these guys hiding now? So they make a real bad mistake. And I think they have learned from their mistake.
But I mean, before we move on to our approaches and all of that, and also understanding the facts behind our numbers and all of that, as one who studied English language, if you make a mistake once, I mean, if you slip once, we say it's a mistake. If you repeat it, we say it's an error, because that's what you know then. And the Ghana Health Service just didn't tell us on one occasion that we peaked on the 25th. When they said it earlier and people disputed it, they came with a graph to actually show that this is when we actually peaked. Certainly that wouldn't be a mistake. That would be something that they wanted to communicate to us and make us believe it was the situation, Dr. Norman, because before we move on.
Well, I think, when people are working together in a group, there's always tough war going on. And this is an example of when people are not gelling together about an important issue to be communicated to the public. When they don't think together as a group, and everybody is trying to take the limelight and become the hero of the day, that is exactly what happens. I have never been part of the group that are working on this. I have never been invited to any of their meetings. But this kind of mistake, considering the kind of expertise they have, the number of people that are working on it, it should never have happened, especially when you're saying with the graphs and all. So it is very easy for someone to conclude that they were trying to deceive the people. I beg to differ. I think they are honorable people. I think they are patriotic people. I think they are heroes of this country. They just let their exuberance, trying to be the hero of the day, they just let themselves go, and they didn't pay attention to the fact that they are not the only ones who can count.
Great. So you've talked about the fact that, this certainly could lead to people doubting the numbers. But talking about the numbers, help us understand, because even with all of this, even before all of these things happened, people still had issues with our numbers. Help us understand the facts, or maybe the myth, behind the numbers that we currently have. 5,408 cases of COVID-19 in Ghana.
Winston, if I had the magic wand to really decode what is going on, I would become a very famous man. The cases are scary, because just this morning we were 5,127.
Yes.
So because of the rapid pace with which we are adding on to our case count, it is beginning to suggest to everybody, you don't have to be an epidemiologist, but just to be a discerning observer, that we don't seem to have a control over what we are doing, and that the experts cannot be trusted. I don't want us to reach that point, because when we reach that point, things will fall really, really apart. I think they can salvage the image issue that they are having now, the PR issue that they are having, and as I have been saying along, come back and really explain why the confusion, what numbers that we should really trust, and so on and so forth. Because from our point of view, we cannot really know where the numbers are coming from, who is counting the numbers, and why the confusion with the numbers. Because counting 5,127, it's not that complex. So why didn't they get it right? Or whatever the number was that they got themselves confused. Because when in a situation like this, where the authorities are the gatekeepers and telling us what we should do to protect ourselves cannot be trusted, it becomes a very, very difficult situation to manage.
Okay.
And so I think the czar that the president appointed, we need to see his face more often because he is the czar. And people who made a mistake should take a back seat because their presence will keep reminding us that the Ghana Health Service doesn't know what it is doing. Let the people who seem to have the credibility of the public now be the face going forward of PR.
But talking about, us testing more, and I just would want to share, some facts. The fact that when the president addressed us on Sunday, he talked about how last Friday a total of 5,253 tests were conducted with 251 testing positive. And then on Saturday, 2,255. Now just watch something. So on Friday, we had 5,000, samples being tested. On Saturday, we had 2,255 being tested. And then on Sunday, we had 3,045 samples being tested. Now, under the circumstances, you're talking about us testing more. But there seems to be a fluctuation in our test. Meanwhile, in some of the jurisdictions, there's been a consistency in the number of tests. So you know that, okay, we're testing 10,000 persons a day, 80,000 persons a day, or maybe 100,000 persons a day. Under the circumstance where we're testing any number in a day, how can we say that we are increasing the number of tests and that is the reason why we are seeing an increase in number of cases, Dr. Norman?
Winston, the confusion here, as I said earlier, is being created by Ghana Health Service and the way and their reportage. I believe that they can streamline the data for us because unless we get access to the data so that we can all look at it and see how they are correlating the numbers, we cannot really say anything other than to take their word for it and then look for the inconsistencies within the numbers. Because as I sit here, I don't have any way of assessing the numbers, 5,000 on Friday, 2,000 on. It is possible, depending upon the number of people they deploy on a given day. It is possible that they can test few numbers on one day and less numbers on another day. So I'm not worried about the discrepancies or the different numbers that they are reporting for different days. Because, of course, if you don't deploy so many people on a given day, you will not be able to do so much. If you deploy more people, because this is a job of more hands on deck.
Okay.
The more people you deploy, the more people you can test. The more testing kits you have, the more people you can test. So I think we shouldn't quiver so much about the numbers as they are reported for the daily testing that they are doing. What we should question are the discrepancies in their own reports, because when they report to us different numbers and the president has to come and tell the public the truth about what is going on to rationalize the numbers for us, I think they are asking the president to do a bit too much, not being a medical doctor and trying to do his best to inform the public. I am angry with Ghana Health Service because I think they are doing a disservice in terms of the reportage, in terms of the clinical work. I think they're doing a fantastic job, but you know what? We can't expect them to be perfect. And nobody is asking them to be perfect. We want them to be ordinary. Doctors, scientists, report to us ordinary figures of events, caseload as they happen.
So when you say, when they give us, they come up with these discrepancies and the president has to come and tell us the truth. In effect, once you're talking about the president telling us the truth, you're saying that the Ghana Health Service lied with the figures. Is that the understanding?
I wouldn't say that they lie, because that is it's a very simple word, but it has big implications. Because if they lie, they have taken an oath to be really meet all the moral values within our Constitution: transparency, accountability, probity. They would not lie intentionally, but a mistake, omission, exuberance, trying to be a hero, all of that can lead to these kind of catastrophic mistakes. And I don't think going forward, I really, really believe going forward, they won't do that again. It will not happen, because I am sure for KCCR to come and dispute the peak or the plateau hypothesis publicly tells you that even those who are doing the real testing are not happy. And when doctors begin to argue among themselves, you know that something is really wrong, because they believe in esprit de corps. They try to protect each other. And even in law cases, it's very difficult to get doctors in Ghana to testify against another doctor. So when they come out in a situation as we have witnessed the last few days happening, there is a problem. I think that it is within the power of the president to make sure that these guys work together as a team, not one trying to fall over the other, trying to be the hero, and make sure they provide the kind of information Ghanaians are dying to hear.
Okay. I mean, would move on, but before we move on, I mean, when you say you do not think that they would intentionally do that, except that when you come out thrice with the same figure, that certainly would lead to you communicating what you believe is the right thing. And like how people would say, when you tell a lie in the morning, you must tell one in the afternoon and one in the evening, just to support the lie that you told in the morning and in the evening. But since you say it's unintentional, I don't know any lie that should be unintentional. But you know, in moving on, let's get to the testing issue that I talked about. So you had earlier, the last time we spoke to you, you talked about the fact that there should be increased number of testing cases. You had advocated enhanced testing. Now, Dr. Norman, if you're talking about enhanced testing, you should send a team out there that goes around and ensures that they have a lot of samples which you can test, a lot of contact tracing going on, so you know what your real situation is. If we are not achieving that, and on Friday is 5,000, Saturday is 2,000, Sunday is 3,000, isn't that an indication that the teams we have sent out are not doing enough in ensuring that we have a lot of samples to test and know what our real and true situation is?
It's not even the question of the testing, because that is done by laboratory scientists, sure, right? The real issue is about the sample collection.
Exactly.
And if you are not collecting enough samples to feed the machinery of testing, then you are going to have these kind of lopsided figures for the days. But as I have said before, we don't have a national plan of intervention, containment, and management. Because if we had one, some of these anomalies will not happen. And so what we are experiencing as a disaster risk management specialist is that we are flying by the seat of our pants as a nation. And so one day, hey, everybody gather together, you are going to do testing today. Hey, the next day, this group, you are going here. It's not organized. And because that's what we are seeing, that is what is coming out. It has been suggested that, and I know that the virologists are gonna be up in arms, but let me say it anyway. It has been suggested that the method we are using, the polling, when you do a sample polling and you test, if it does that group, that pool doesn't show positivity, then you move on. If you pull a lot of people together, maybe 10, 20, 30 people together, and you do the test, and it comes out positive, then you have to go back and test everybody. So the method that we are using could be part of the reasons why we are having some of these corrections. The corrections are okay if they are being done systematically, as the president came to do it. I do not see in a human situation like this where so many labs are doing tests. If we miss a count here, count there, that's okay. But I think the real problem, the real issue is the method that we are using, for which Ghana has been applauded. I am not a virologist. I am not a scientist in that area. However, I think attention needs to be drawn to the method we are using to see whether it is actually as efficient and serving our interests as it should be.
But you are a public health person, a public health specialist. The method that we are using, do you think it is serving our interests?
Well, I think part of the reasons why other countries and other WHO wants to know how we're doing it is they want to assess it. It's not just to praise us. They want to evaluate it and see whether there are weaknesses within that. Because if there are weaknesses, God help us, it means that there are a lot of cases that will be missed. So, like I said, I don't have the trained skill to really look at the method, but those that have looked at it have suggested, Dr. Yakubu Aparabo has suggested, and others have suggested that the method itself needs to be interrogated to make sure that it is not, there are no gaps that is being left.
We'll go for a break shortly, but you know, one other thing I would like to find out from you after we return from that break is because we know that there's been instances where we've tested people and they come out, you know, negative, particularly when they've tested positive earlier. They have to, you know, have negative results on 2 occasions. And then there's been instances we've looked at that persons have tested negative in the first instance and then tested positive again. Can't it be the case that in some of the poolings that we do, some persons, you know, if we had run the test individually or later on they'll be testing positive, even though they tested negative initially? This is UPfront on JoyNews channel. I'm Winston Amo. We'll be right back after the break. All right, so welcome back from that short break, and thank you so much for staying with us. This is UPfront on JoyNews channel, and I am Winston Amo. This evening, we've been joined by Dr. Ishmael Norman, who is the president of the Institute of Security, Disaster and Emergency Studies, and also a public health specialist. So before we went for the break, Dr. Norman, I was asking that question about, you know, because we know that there's been instances where we've had false negatives and all of that. And since we are also considering, you know, maybe just testing persons on one occasion, if they test negative, after testing positive, then we say that those persons have recovered. Quick questions, should that be considered?
Yes. Early in March, CDC US had very serious problems because of the testing kits. Many of it that they were using were found to be unreliable. And other countries have experienced the same. I do not know the percentage of the testing kits that are unreliable in our inventory. And because of this, I am not surprised that they will do a test. One day that the person will be negative, and another day the person will become positive. I think we tend to trust too much on things that are given to us by white people. And we don't question, we don't assess their validity and so on and so forth. So I do not know how the testing kits were evaluated by the FDA or the standards boards or any of the oversight institutions that assess the efficacy of products that come into this country. But maybe because of the haste that we needed to actually apply the testing kits, that maybe we didn't do a thorough job assessing.
Hold on, Dr. Norman. Just hold on 1 minute. Are you doubting, you know, the ability of the test kits that we have to work effectively? I
am not doubting. It has been established by other countries that the testing kits from China have had issues. The US CDC had issues with it, and so are other countries. So why should Ghana be different? And especially since we got it more or less from the same geographical source. So what I'm saying is that maybe there should have been more attention towards evaluating the efficacy or the efficiency of the test. Because in every production line, there are latent defects, and it's only when you use a product that you discover the latent defects. So the false positive that we are getting from people that have been tested could be attributable to the latent defects in the testing kits.
As in the false negatives that we are getting in some instances. Okay. Now, you talked about how decisions and approaches to COVID-19 not being the best. You've also praised, the testings that we have done. Apart from the testing where you think that, okay, well, our case count is because we're testing more. What is wrong with our approach in fighting COVID-19?
Well, there's nothing wrong with the approach. The approach itself is reviewing the weaknesses within it, i.e. the discrepancy that in the numbers that we've been talking about. If the approach was ironclad, there wouldn't be the discrepancies. So if we take the approach as is, it is the approach, when you evaluate the approach as is, it's reviewing to us there is something wrong. And that is what we need to interrogate further.
But apart
the
from
number of tested cases that they have done is quite commendable. 160,000 of them.
Sure.
Now I'm sure it's gone up, especially because we have also gone up in terms of positive cases. So they are doing a good job on the clinical side. Nobody can fault any of the labs doing the job. What is happening is that maybe the approach itself is suspect.
What is suspect about the approach?
Because there is internal inconsistency.
Okay, so
in the results,
that has been
the numbers that they are giving us.
That has been established, and in moving on, you also raised questions about some of our decisions that we've taken in this fight beyond the health bit, beyond the science bit. So let's look at those decisions and how you think that why you think that there are issues with those decisions that we've taken, apart from beyond the approach which you say is not top notch, and you've criticized the means of communicating. What other decisions have we made that are not the best?
I think it all starts from systemic issues that we have had with respect to our preparedness. I felt sorry when the president, in his stature, was actually reciting to us the number of test kits, the number of PPEs, I felt sad.
Why?
I think that should be the work of the technicians, not the president standing in front of the nation and telling us the inventory of test kits or PPEs or gloves or face masks.
Why can't the president do that?
Oh, because there are certain things. There's a beautiful ceremonial aspect that comes to that with the presidency. And I felt like that shouldn't be. I haven't seen any of the leaders doing, maybe I don't watch enough TV, but yesterday I was watching a congressional report by various experts, including Dr. Anthony Fauci and people from HHS, the Health and Human Services, making presentations to Congress yesterday, which was telecast internationally. And I didn't see any one of them, even at their level, giving an inventory of test kits or PPEs or whatever. So the president should come with the broad strokes, like an artist who comes to finish the work of his peons. So I didn't feel too comfortable. I don't feel comfortable watching my president doing that kind of updates, really. Okay. The other thing, going on the substantive issue, because that is what I just said is just window dressing, ceremonial stuff. The other issue is that up to today, we do not have access to the country's preparedness for containment, for management, for prevention. We don't have anything. And so we are listening to a few staff of Ghana Health Service tell us what we should know. And because of the lack of transparency, we are constantly updating inputs into the national effort. Okay. Maybe if a lot of people have seen the preparedness plans, some of these things could have been tackled holistically rather than piecemeal.
Talking about our preparations and talking about preventive measures, and so the ministers, the Minister of Health, the Minister of Information have consistently told us, that as part of government plans and as part of government measures, yes, government decided to close, borders, our entry points, decided to close all of them. Government also decided to ensure enhanced testing, so they'll be able to know the number of persons that are, have contracted COVID-19. They also decided, as part of the strategy, to come up with the preventive measures of the protocols. One, they locked down, there's restrictions. Are these all not plans that have been put in place? And don't these tell you the strategy in dealing with COVID-19, Dr. Norman?
Okay, as you enumerated, almost every single one of them that you enumerated was an ad hoc thing. It was not, before the event. It was after the event.
How do you know it was ad hoc?
Well, because when you don't have, for example, the legal framework, every country, every government should have a legal framework in place that if, the unthinkable happens, this is what we're going to do legally. This is what we're going to do economically. This is what we're going to do. Yesterday on social media, a document, HR 748, that is a U.S. Congress resolution. And people were questioning the resolution for COVID-19 intervention on the U.S. was actually drafted in December 2000.
All right, Dr. Norman, unfortunately, that would be your time would allow us. Thank you very much, Dr. Ishmael Norman, who is president of the Institute of Security, Disaster and Emergency Studies, joining us today on Upfront. I'm Winston Amo. Thank you so much for doing the watching. Have a lovely evening.